for me, like clinically, if I'm working with someone who doesn't have housing, like that's sort of number one, right? Like that's the psychiatry vital sign. Like if you don't have housing, like it's so hard to address depression. It's so hard to help somebody stay on their meds. It's so hard to get them connected to like good food. And I think that just is something that, it takes precedent, and I wish we could direct more attention to.
Hello, everyone, and welcome to the Life on the Line podcast series focusing on intersectional youth mental health. Today, we're going to be focusing on socioeconomic inequality. My name is Megan, and I'm the founder and director of 2020 Arts and the creator of the Life on the Line campaign. All the details surrounding the art fundraiser for the Canadian Mental Health Association Toronto will be in the description down below. And on today's episode, we're going to be focusing on the impact that socioeconomic inequality can have on youth mental health outcomes. I'm really excited for this episode. We're going to consider the critical roles that social, economic, and political factors play in generating and reinforcing social hierarchies, why we aren't currently investing in people, what that means for youth mental health, and what we can do about it. So today I'm joined by three amazing panelists. The first is Amie-Archibald Varley, who is a thought leader in advancing health equity and political health activism in healthcare. She's a dynamic speaker, freelance writer, scholar, regular media contributor, and the co-host of the Gritty Nurse podcast. The second panelist is Maggie Hulbert, a senior resident physician training in psychiatry at the University of Toronto. She is also the co-chair of Health Providers Against Poverty, a national volunteer-based advocacy coalition of health and social service providers that have a broad anti-poverty mandate. And last, but of course not least, is Nikhita Singhal, a psychiatry resident at the University of Toronto. Her desire to pursue a career in the mental health field was initially sparked by her own experiences as a patient, and she hopes to harness this work towards addressing current challenges in the system and enhancing the care we can provide to those struggling. So before we get started, since socioeconomic inequality is such a broad, expansive topic, I just wanted to lay a little bit of groundwork for the discussion. So starting with the social determinants of health and what that means. So the social determinants of health are the social and economic conditions in which people are born, grow, live, work, and age. So your environment for the most part. And according to the Canadian government, social determinants of health include race, education, food security, sexual orientation, Aboriginal status, disability, housing, income distribution, and more. So today we're going to touch on how these determinants specifically are influenced by an unequal distribution of money, power, and resources. So without further ado, let's get started. And I think the best place to always start is just to learn a little bit more about all of you. And so if you could all just tell me a little bit about yourself and what led you to the work that you're doing now.
Great. Thank you for that introduction, Megan. So I'm Maggie. As I said in my intro, I'm a physician, so I'm in training, and I actually work sometimes with Nikhita. We never actually often get to work together, but we're in the same program, and I'm training in psychiatry. So that's sort of my job. The part of the work that I think is how I got connected to this podcast is my work with Health Providers Against Poverty. So that's an organization I've worked with for the past 4 years. And it's generally just a group of healthcare providers and social service providers, people who work in shelter, people who work in community services all over the country who, in general, I think we could describe ourselves as being people who are very mad about the state of healthcare and the intersection with social determinants of health and want to do things outside of what's within our scope in healthcare. And so I think that initially when I saw the question of what, led you into sort of this work around advocacy, a lot of it just comes from sort of feelings of frustration and anger, and needing an outlet to channel that into. And it's something that I take a lot of pride in, and it means a lot to me personally. So it sort of adds that sort of like personal human element to a lot of the sort of healthcare work, which can, at times in our system lead you to feel a little bit isolated.
Hi, everyone. My name is Amie-Archibald Varley, and I'm a nurse. I also have my master's degree in women's health, and I also actually did some studies relation to transgender health. in terms of just some of the various different things I've kind of gotten myself into, I should say really gotten myself into, is over the past, I guess I'd say 3 years, just actually before the pandemic, myself and my co-host both had really significant mental health challenges through our workplaces. And we found that although we were having this same experience, we were experiencing it together, but through a silo. So not even knowing that each one of us were actually having this experience. And I said, we can't just leave it this way. We must have to have an outlet for what we want to do. And thus the Gritty Nurse podcast came into play. And we just decided to have a podcast where we talk about these issues. We talk about mental health. We talk about the socioeconomic factors that cause some of these challenges that we see. We wanted to talk about racism and anti-racism in healthcare and nursing. And it's a passion project. It's something that I feel very strongly and deeply about. I've told many times, I'm not going to get into it now, about my very first experience with racism. And I think it's a stark contrast to some other folks who maybe didn't experience racism at 7 years old or whatnot. So for me, it's always been something that has been in the back of my mind as something that I want to do, just never really actually felt that I had that voice. And in 2019, I found that voice, and I am not going to stop at having these conversations and providing insight onto, some of these things that cause harm in healthcare. So that's where I am. Oh yeah, sorry. I'm also in quality improvement. So that's the other piece of my nursing career. But yeah, that's what has led me to where I am today.
And I can jump in again. Thank you for the introduction. And honestly, it's such an honor to be here among people who are so inspirational and doing so much. As was mentioned, what kind of initially sparked me to come into the field of psychiatry was my own experiences in the mental health system as a kid growing up, as an adolescent. And I actually came from a place of significant privilege, and just seeing how challenging it was for other people in similar positions to me, and then adding on to that all of these intersecting layers, and seeing how difficult it was to navigate without that, and then trying to imagine what other people were going through. Really, I think Maggie mentioned anger and frustration with the system has been a huge driving force, and then trying to kind of like channel that into what Amie mentioned, passion. It's really, I've been so fortunate. I think one of the things that's been really helpful along this journey is just having amazing role models and mentors. There's one actually, like a psychiatrist who is like a staff and faculty within the program that Maggie and I are part of, and she was somebody I saw, and I was so in such admiration of the work that she was doing. And so I've really, I've had the opportunity to kind of learn more about how we can try to advocate for change, like on an individual level with patients, but then also on a community level, on a societal and structural level. And so that's kind of part of what's brought me to where I am now.
Thank you all so much for sharing that and doing a brief little introduction to you, who you are, and the work that you're doing now. I think the theme of anger resonates, I'm sure, with everybody here, and just feeling frustrated at stagnation and a lack of progress when we should be moving forward. And so for me personally, when I was younger, there was like this specific moment for me when I realized that I was living in an unjust society. And when you're a teenager, like you're fairly carefree, or if you have the benefit of being carefree anyways, you don't tend to think about those structural issues. But seeing and being exposed to poverty really made me realize, oh, our world is super unfair for some people. And hearing people speak disparagingly about homelessness was the thing that really, for me, shifted. I need to do something, or I want to do something, or I want to use my voice to be able to do something. And then followed by many other occurrences after that, and experiences with my own lived mental health experience. And so I know we've all kind of touched on what inspired you to do the work that you're doing now, but I wonder if there is an example, a specific moment or circumstance or event that made you, or just reinforced you wanting to do the work that you're doing now?
Yeah, thank you for that question. I think that it's an excellent one. And I think storytelling is actually really powerful. And this is how I think most people actually connect with one another, through these various different shared experiences, or, through just understanding and seeing it through a different lens. So in terms of just like a specific moment, I feel that for me, it really has been a collection of moments. And I hate being cliche, but really for me, the turning point was continuing to see some of the harm that was happening in the United States. And it happens here too. Of Black folks that were, that had mental health challenges and struggles, and seeing the harm that befell them, and seeing and recognizing that, I have a brother who has bipolar disorder. I have a brother, he also has bipolar and schizophrenia. Realizing that Black individual is my brother, my friend, my cousin, my uncle, my dad, and really thinking to myself that I can't I can't sit and continually watch it happening. And I actually have advocates in my family as well. So my cousin Sandy Hudson is the co-founder of Black Lives Matter Toronto, and watching some of her work and just saying, what, from a healthcare perspective, I do have voice, I do have agency. And we've seen it in cases like with John River, a Canadian rapper who came to the emergency department many times saying that something's wrong with me, and was not believed. And I said, you know what? I have to have agency here. Even if, and when I started my podcast, I said, even if nobody's listening, I feel that I'm putting the story out there. I'm putting the message out there. I'm giving that opportunity for folks to think differently about some of the situations that they see in healthcare, that they see in everyday life, and saying, you know what? You can be a part of the solution. Because I felt at one point in time that I couldn't. I felt helpless. And I felt that advocacy and lending my voice and seeing what was happening, saying, you know what, I've had enough. I need to be a part of this change too. And knowing that it's not just a US problem, this is an international problem. Homelessness, poverty, racism. These are things that we as everyday people should be tackling on a day-to-day basis. And I just felt that, you know what, it's my time to be a part of that movement as well.
I think for me, it would also probably be a collection of different moments accumulating and just getting to that point where it's like we can't be silent anymore. I think a lot of my frustration initially, it stemmed from hearing this sentiment over and over again that like people were failing treatment, or like kids, like it was like, oh, people being written off and so unfairly. And I mean, for me, it's really like we are failing patients. Patients don't fail treatment. It's like we are clearly not doing something right. And the system is broken and we need to address that. And just, I think over time, like I've had, as I mentioned, amazing like mentors in the community and other people supporting me to kind of find that voice and do this kind of work, because it can be tough, especially in medicine. There's always this power imbalance, and there's hierarchies. You're a student, you are a trainee, and there's always somebody more senior. And I think just realizing that no matter what stage you're at, like it doesn't take a number of letters after your name to be able to identify that there's something wrong here and that we need to change what we're doing. And I think that that's really what kind of the impetus has been, is seeing the stagnation, seeing that we need to do something to change. And again, just hearing people's stories. Amie mentioned stories are so powerful, and that's what we have. That's what drew me to psychiatry partly as well, is just that we have the privilege of playing a role in people's stories and hopefully being able to change the narrative all around.
Yeah, I would say for me, like definitely like a collection resonates. I think it was just sort of it's really hard once you start like I think when I was in medical school, once I started noticing just how different things were for people who didn't have money, like how different the outcomes were, how different your recommendations were, you really start to think about like, well, this is a lot of people who don't have money and then they're not getting access, and you sort of put things together. But I think the pandemic was a real eye opener for me in terms of advocacy. That's where I started working a lot with HPAP, and we did a lot of campaigns around like COVID safety in shelters, even things like telecommunications, like everything moved virtually, everything moved online. That assumes a pretty large degree of privilege, like socioeconomic privileges. I just saw a lot of those people being left out of conversations, and already knowing that they have worse health outcomes just by the amount of money that they make. So I think that sort of made me really pay attention in a way that I hadn't before in terms of like how to advocate. We're seeing the inequities related to the pandemic.
Thank you all for sharing those personal situations. I think it always starts as this like little flame and little fire. And then as time goes on and those inequalities continue, you just feel like your frustration and your anger and your desire to do more. And as individuals as well, like just, adding on to what you've all mentioned, like it's important that you do something. And we all feel like our influence is so small and that we don't have this big impact as individuals. But actually, if we're all collectively doing just something, just a little bit, it does make a really big difference. So thank you for sharing your stories. Obviously, with socioeconomic inequality, there are so many different topics that we could touch on, including like a lack of affordable housing, a stagnant minimum wage, and inadequate social support, just to name a few of very many. And so I wonder if you could each just share a little bit about why inequalities like these can be so detrimental to mental health, and touching on any one particular area of socioeconomic inequality.
I think I kind of mentioned this before, but something that's really struck me is that for somebody who is privileged, it's difficult enough navigating the mental health care system and coping with mental illness. Even if you have amazing support from your family, from friends, from other kinds of social networks, even if you have stable housing, and even if you have adequate income. So when you start to layer in these things, something that became really, really apparent to me, especially when I've done some rotations working with community outreach teams, and just seeing that all of these plans we develop for people, like Maggie mentioned, like when people are in the hospital, and then when you actually take a look at the reality of their situation, what they're living with. And these are things that people kind of are born into these circumstances, things happen, and they don't have control over it, and there just isn't support that's provided. And so even when it comes to maybe affording medications, being able to transport yourself to a clinic or a hospital for an appointment to see a physician when it's virtual, like people don't have access to technology. So in COVID, that's a huge concern as well. So I feel like all of these things, again, it's difficult enough to navigate this system when you've got all the resources in the world. So trying to do it when you have so little it's really like we're asking people to do the impossible. And then, like I mentioned, we kind of label them as like not this is something we say all the time, like people are not adherent or not compliant with the treatment. But we got to think about why they aren't, and what we can do to support them to be able to access the help that they really need.
Yeah, so many of those topics. I feel like I would want to hear a podcast on each one of those things. Housing is something that I think a lot about, and HPAP has traditionally done a lot of advocacy around shelters. And youth homelessness is becoming, and has been for a while, a huge issue. It's the fastest growing population of people entering homelessness are people under the age of 18, which is really scary. There's a lot of overlap with mental health issues. There's some estimates saying like 75% of people entering homelessness when they're younger have mental health issues. And then there's also, I think, something that's really important to me as a member of the queer community is like there's a large proportion of people going into youth homelessness as youth because of their identity as part of the LGBTQ groups. So I think that is like so many overlapping layers of like mental health relating to like social determinants all sort of manifest as a young person not having anywhere to sleep. And there's, I think, considerations for how we like there's differences in populations. You can't manage youth homelessness the same way you do adults if our government manages or directs any attention to it at all. But, it's hard for someone under the age of 18 to live fully independently, cognitively, they're not fully able to do that yet. So I think there's those sort of overlap. And then there's a connection with intergenerational trauma, which I think is something I think a lot about with youth mental health. Like often people like this is passed down, and people like their parents weren't given coping skills because there wasn't enough attention there. And so then there's a lot of struggle interpersonally. And that is actually one of the main reasons that youth actually enter homelessness is due to like interpersonal conflict with family. And so it's different. And it's also an area that we can intervene in. So I see a lot of potential. And I also just wanted to quickly mention, because I think it's something that it's important to consider, is there's also a separate like Indigenous definition of homelessness that's separate from just not having a physical structure, but there's many components to it. But one of them that always stands out to me is sort of not having a connection to land, not having a connection to family. Those are also types of homelessness for Indigenous people. So certain things to think about in terms of youth. And for me, like clinically, if I'm working with someone who doesn't have housing, like that's sort of number one, right? Like that's the psychiatry vital sign. Like if you don't have housing, like it's so hard to address depression. It's so hard to help somebody stay on their meds. It's so hard to get them connected to like good food. And I think that just is something that, it takes precedent, and I wish we could direct more attention to.
Yeah, Maggie, you took some of the words right out of my mouth. I think when we think about, some of the basic necessities, food security, housing, adequate income, we've seen what, the CERB did for in terms of just basic income for folks during the pandemic. Why don't we have policies like that are, permanent? And one of the things that's kind of an overarching theme about all of these various different things that we've talked about is policy decisions really impact the way that folks that are like youth and how mental health is seen on a whole. I think one of the things I want people to really understand is these folks aren't making these decisions on their own. It's the policies and the power and the privilege of folks in these roles that are creating these systemic inequities, and they continue to be passed down through enforcing more policies, criminality of folks that have mental health crisis and illnesses. We've seen all of this. So again, like there's so many different, honestly, like you're right, we could do a podcast on each one of these various topics. But again, we need to look at how we are creating these inequities through the decisions we're making with our politicians, how they're like, this is why I say, get out there and learn what's happening with your MPPs, learn what's happening at your MPP offices, and be involved, because it's policy decisions that are creating these inequities again. And we have to think about these things differently. We have to do this work differently. And I mean, I really don't know what else I can say in terms of just all of the different things that we need to be aware and cognizant of to actually make change in terms of, seeing better healthcare outcomes for youth and mental health in general.
Thank you all for all of those answers. One of the things that I used to think about mental health and the way that it's framed, like from a corporate or CSR perspective, is like, oh, we're going to try and treat mental health as if it's something that occurs in isolation. But oftentimes, based on what the things you're speaking about, other than some of the biological factors, being born with a mental health disorder is obviously a factor. But then there's all of these environmental, social determinants of health that worsen mental health outcomes. And so if you're a proponent for mental health and therapy and providing equal access to that kind of care, then you should also be a proponent for affordable housing and social programs and all these other things as well. And so, yeah, it is kind of frustrating to see oftentimes when mental health is spoken about by big companies specifically who may be negatively contributing to people's mental health through their policies or regulations, that they're not talking about those things, even though it's pretty obvious to us why they're not talking about those things. And just to add on to your points, it obviously having mental health struggles after having some sort of struggles with your finances, your housing, your relationships, or whatever it might be, and then having mental health struggles, it makes it even harder for you to escape those conditions. And so there's no shortage of evidence surrounding the extreme physical, emotional, and mental impact living in poverty can have on an individual throughout their lifetime. And when we don't focus on early intervention, this can lead to more significant costs down the road. And governments, as a general rule, don't want to invest in these issues upfront. And we're seeing the impact of that now. So I wonder, what is the real cost of not investing upfront, and why aren't governments investing in these issues upfront?
Such good questions. Yeah, in terms of like, what is the cost? I'm sure there's somebody out there who has actually put a number on what the cost is. and studied like what all the cost saving measures. I think something that I always think about when we think about cost is sort of, sure, cost is an important thing, but it's hard to quantify the value of someone's wellness and life. So it's also important to think like, even if the cost benefit analysis didn't make sense, right, it would still be important that we invested in mental health because people's lives matter. And as soon as you start dividing whose life is worth this much and whose isn't, that's where we get into, these sort of neoliberal kind of hierarchies. So I think cost is one thing. And then at the same time, I can also say definitely it would, like, investing in youth mental health would pay dividends, not only in actual money, but in just the well-being of our society. Particularly, I think a lot about the intergenerational trauma piece, because so often, if you invest in a young person and help and give them tools, give them a safe place to live, help them, complete their education, you can see like benefits for generations in their family. And that's, I think, when we think about the residential schools, we see how that interruption of that investment and that in like direct harm really has had so many adverse outcomes for people for generations in Indigenous families. So, we see the converse of that, but you also can see the benefit if you do see that investment. And that's one of the most exciting things working with young people in the mental health field is you can see people have such great change and make so many amazing connections. And you can see much benefit to their whole family. I would also say, like, as a specific plug, working in psychiatry, there's lots of studies on psychotherapy. Psychotherapy is not adequately funded in our province whatsoever. And psychotherapy also helps prevent relapses for a lot of mental health conditions that medications just don't. And medications generally are better covered by OHIP. So there's sort of like evidence on that piece alone that it actually could help you more in future with preventing relapses of certain mental illnesses if we did invest in therapy. Why the governments are not doing it, I don't know. I have my pessimistic thoughts, but I think unfortunately, the people who benefit from this are not necessarily the people with like the voter impact and the money that are influencing politicians. And so it's really easy to ignore. And so that's why I totally agree with Amy's point. We really need to get people involved in politics, because young people involved in politics, people who've experienced all of these inequities, because, we need that attention for sure.
Yeah, I agree with you, Maggie, in terms of all of the different things that you said, in terms like just you can't really quantify what that cost may actually be. I know there are numbers or there are stats out there, but again, you can't put a dollar sign on people's lives. I think there's fundamental issues with that as well. And I think it also boils down to the conversations we continue to have about mental health. I'm so glad that we're having these conversations today. They're hugely important. I think back to even when I was a youth, how infrequent the conversations were. And then again, looking at that other pocket of the fact that I was in a racialized community where there was more stigma about just talking about mental health. And I think that, the benefit that we will see in having these conversations in early intervention is that we can make change early. I think young folks are so moldable. I think that if we give them the opportunity, we give them all the tools and equip them with what they need, we can help with some of these challenges that they might be facing. I think that is the best time to have these types of interventions. And again, it's these policy decisions. So why do they not do it? Because mental health is not seen as significant as if I broke my leg. That's why. It's the craziest thing that, I can say to my employer, or my employer can look at me and say, okay, I have a plan for your return to work based on your broken leg. So I know it takes 6 weeks to heal. I know this and this and that. But when it comes to me saying, I have a broken mind, they can't quantify that. They have difficulty understanding the capacity in terms of how that might work with productivity, how that might work with work-life balance, how that might work with my relationships with, people at home or with my children. So again, we have to continue having this conversation because people do not see mental health as healthcare, and it absolutely is. We have to change the way that people think about mental health. And this is why, we have to continue having these conversations. And I want to see the positive in this. So although the question is kind of like, what are the costs? I think we should look at what is the quality of life that we can see for youth and other folks suffering from mental health challenges.
Yeah, like 100%. There is still this a huge amount of stigma towards mental health, and I think something that Maggie had mentioned as well, just this idea that when we do intervene early and we see how dramatically people's lives can change, it's really it's something to behold. And I think I continue to be blown away by the short-sightedness that our government show and that society shows in facing these things. I mean, I think, yeah, we can have like hypotheses about why these things are. It just seems so short-sighted because there have been those analyses done, and it's been demonstrated that how much it really pays. Like, again, hopefully we should do this because we want to help people and improve their lives. But if it is coming down to money, it's just going to save so much for society as a whole to be more preventative. But for some reason, our healthcare system, just everything that we really operate on is very reactionary and kind of like putting band-aids on things after the fact. And that's, at the end of the day, we need to say that's not enough. I love this. Like I heard someone say we need to not ask like what's wrong with you, but what happened to you, and thinking about all of the things that have happened in people's lives, whether that is like going through poverty, the trauma, going back generations, let alone within people's own childhoods, thinking about how that has shaped where they are instead of just kind of like labeling them with something and then saying, okay, we need to like Mike said, like medications can help people, and at the end of the day, they're not getting to that root where psychotherapy, again, it's one of those things, it takes more investment and time and effort up front. So in the short term, it's like easier to say, maybe we'll just give you a pill, right? But long term, that's where we're going to see like a lot of the healing. And yeah, I'm frustrated by how we just are failing to really see that. And I think, as Amie mentioned, this is where it's so important to get involved politically and to push for that, because the more voices we have adding to that, the harder it is to ignore us.
Yeah, absolutely. I think, definitely not losing hope, and just continuing to push and get involved in any way that you can. And I mean, I completely agree with all of you, and that obviously early intervention, like, it leads to better life outcomes in general. And so people have better odds at living independent lives later on if we intervene at an early stage. And it is super frustrating to see the political system the way that it is, and the way that it's generally structured as well. Like, we all feel very powerless. You vote once every 4 years. And even when you do vote, the way that anyways, I could go into a whole rant about the way our voting system is structured and how it's just ineffective all around, and that it's not an equal distribution of power, and it doesn't reflect what the people want. But anyways, and yeah, that can be extremely frustrating. And then our system does tend to benefit people who want money and power. And when you don't have ethics, it's very easy to make decisions that negatively impact people, whereas compassionate people, empathetic people who want better quality of life for everybody, aren't willing to cut corners or to, put somebody in a negative situation to get in a position of power. And so we're always working double time, but it's worth it. It's always worth it. So that being said, and on that slightly possibly negative note, for anybody who is struggling, any young person who may be struggling, and I think this is kind of a silly question in some ways because access to something like a podcast on YouTube may not be accessible to somebody who is living in poverty, but just as a broad general statement for anybody who might be struggling, and their socioeconomic situation may be impacting their mental health in a negative way, what advice would you give to young people who find themselves in that situation? And it could even be things like resources that they may not know exist.
Yeah, I think the first thing is normalization, right? I think what I needed someone to say to me is it's okay to not be okay. Just for someone to be like, you know what, this is real and your feelings are real. To have that extra validation, to say that, to have that sounding board. And I think the first piece is, please, if you are struggling or you feel that, that you're having difficulty, please reach out. You could reach out to a friend, reach out to another adult, reach out to your teacher, reach out to whomever, but let somebody know how you're feeling. I think sometimes we don't talk about it enough. Like, like I said, I'm happy that we're having this conversation. And I think, again, even just thinking about in like my own community with Black folks, how there's so much stigma still surrounding talking about mental health, that the first thing is just to say, hey, you know what? Because sometimes it might not come out the way that we think it might come out. It might just be like, I'm having a really bad day. And for us to listen and to continue to ask questions, like you said, Nikhita, what happened to you? I think that's such a powerful and such an important question, as opposed to saying, like, what's wrong with you, or like, why are you feeling that way? But to say, hey, like, what's happening? Tell me what's happening. And I think that, there are lots of resources out there. Of course, there's the traditional resources like Kids Help Phone and various different hotlines that folks can reach out to. But again, that immediate letting somebody know, a family member or friend, and just saying, hey, you know what, I'm struggling. And then to just let them know what's happening with you. I think that's probably the most important step that anybody can take. And then just to give that reassurance that it's actually okay to have these conversations. I remember being very fearful myself, even having some of these conversations initially, and just for someone to say to me that, it's okay, let's talk this through. Or even someone to just say, hey, you know what, I'm going to open the curtains for you to help you get out of bed today. That meant the world to me. So I think that you have those conversations, and the first thing is just please reach out. And then again, through reach out to your family, care providers, whoever that might be, and, start the conversation early and often.
100% echo those sentiments. I think for me, something that I really hope that like young people would take away is that really don't give up. And it can be so hard. I mean, we ask so much resilience of people already who are struggling with all of these things, and you're going to run into barriers. There's going to be experiences that are negative. There's amazing grassroots community organizations out there, a lot of peer support, a lot of great people doing great work, and also it's not going to meet everyone's needs. And I think I would really just want to highlight for folks, if you have an experience, you interact with a therapist, and it goes negatively, and like that's terrible, and I'm sorry, and I really hope that doesn't stop them from continuing to speak up and seek help, because so much of it is about finding that right fit. And it always like it really, it's so difficult here when people have said like I've tried everything, and being told again that like they're failing, they're treatment resistant, they just can't be helped, and people giving up on them, when really it's like we are failing them. And we put a lot of the onus on people to kind of continue seeking that help themselves, and the way our system's currently set up, that's what people have to do. And so whatever, like, hope they can hold on to that, just keep trying, and don't give up on seeking help.
Yeah, I thought about this question a lot, because I was thinking about what I would want to hear and what I would want. I think I have some patients who I think about who are younger, and what I wish I could have said. And I think similarly, it can be really hard in our system to get good help, and it can take a lot of tries, but to know that you're worth it, right? Like that persistence, your voice, your presence, your experiences are so important for shaping the way that our world is moving, the way politics is moving, the way we're talking about mental health. And you matter, and the persistence is worth it because you matter. Medications and therapy can be really helpful. I think I can't understate, like, that can be really scary for people to have to try medications, to have to go to therapy. For me, it's like, I don't even think about it, but I know that that's out there, and just, it can be very helpful, and there's no shame in trying that. Just, that's what some people need, and you don't necessarily need it forever, but that's a tool that can help. In terms of some specifics, there are a couple of things I always like to share with some younger people who might be struggling with, socioeconomic circumstances. One is that if you're age 16 to 17, you actually can get a benefit from Ontario Works, which is an income support program, and CAS, Children's Aid Services. They also provide not a lot, but they can provide some discretionary funding. So those are sort of two avenues to go specifically for financial support, which is really hard when you're younger. There's not the same income support that we have for adults. And then in terms of housing, there's a few youth shelters in Toronto. And I will say youth shelters, at least the ones in Toronto, have a pretty good reputation. Covenant House in particular is one of the most well-known. And there are actually some transitional housing services aimed at queer youth. You can access them through Friends of Ruby. So those are just some specific pieces I just like people to know about because I think they're great.
Thank you all so much for sharing all of those pieces of advice and some of those resources. I love what you said, Nikhita, just about like, don't give up just because you've had one bad experience with some particular thing. It doesn't mean that none of those things are going to work for you, just that you have to keep trying and find the one that fits for you. I think that's what's really difficult for a lot of young people, is that there is no formula that's supposed to fit you. Nobody's going to be able to tell you what fits you exactly. And you kind of have to figure it out on your own, with the love and support of other people and different resources. But yeah, it's one of those things you have to experiment and try new things. And it's really tough too for young people who have to advocate for themselves when they're already struggling with their mental health. And so, like you say, it's not set up in a way that is beneficial. So lastly, for anybody who's listening to this discussion and feels like they want to do something, like they want to get involved, like they want to do what you've all done by advocating through your work for health equity and for equal access and to all of these amazing things, what can they do? What can people do to get involved?
I think this is like something that's been expressed already, but like everything counts. Even what seems maybe just a small insignificant step. One vote. Again, we all vote, and that's what leads to change. So I think for me, yeah, one thing is just doing something. No matter how small it starts off or how small it seems, is huge. I think personally, like what I found is that like sharing stories, again, that's really, really powerful. Some of the experiences that I've had, like when I first started like going and speaking to members of parliament, members of provincial parliament, I was really like struck by how much they actually seemed impacted by not just, you can give them data, you can give them numbers, but at the end of the day, what resonates with people and what they remember are stories. So sharing personal stories, like stories of patients that and the people that you're seeing, and that is what really can spark someone to like, oh, I actually never thought about it that way before, even though like for a lot of us, we see this every day, but for some people that can be eye-opening. So share stories if you like, and again, not everyone is in a place where they have kind of the capacity to do that. And if you feel comfortable and you can do so, that can be really helpful. And yeah, getting out there and speaking up and just, yeah, politically trying to do what we can to influence things.
Yeah, totally. I think we're all probably going to say the same thing, but voting is very cool. Everyone should vote. Voting is cool. And getting your friends to vote is cool. So voting is, I think, like there was such bad voter turnout this last election, and look what happened. We're stuck with Doug Ford for another million years. So I think voting is like one of the seemingly smallest but most important things you can do, especially as a young person. Like no one thinks 18-year-olds are going to vote, and they count on that. So I think really like being resistant to that idea that your voice doesn't matter, and getting involved, of course, like it can be hard to know what that means, but just trying to understand like who pays for what. That was something that took me a really long time, like understanding that healthcare is provincial. So actually, like I can speak to people from that level of government who can influence that budget and where that's going. So paying attention to those kind of things, it seems not important, but as you get older, and I think if you're aware to these things, you realize it is really important to know where the money comes from. And then lastly, I think peer support is such a powerful and important intervention. I think especially like if you're someone who has the bandwidth and is interested in getting involved, there's something so powerful that as a healthcare provider, I can't even provide, like as being a peer and saying, I've been there and now I'm here and you can do it. I think particularly for racialized communities, like as Amy's been talking about, people from the Black community, Indigenous community, I've heard there's so much silence, and it can benefit so much from having someone else with that same lived experience, a similar cultural experience. Like that is so important. And if you're interested, Stella's Place is an organization in Toronto that does actively take peer support, and you can start that pretty quickly. So that would be something I would say people could do to get involved.
I don't know what more I can add. You guys said all the really great stuff. Yeah, I mean, voting again, like everyone said it. It's super important and it is cool. Like I'm glad that you said that. It's actually I'm gonna add it's dope to vote. So yeah, get out there, have your voice be known. And the other piece that I think that behooves us as maybe millennials or whatever group that they would plump us into. Social media is powerful. It is such a powerful engine to, once you have an idea that you feel strongly about, feel passionately about, get out on social media and blow that whistle. There are so many politicians I have interacted with through Twitter, various different groups, people that you would have never thought that you can connect with, that you can build connections with and alliances with in terms of your advocacy work. And advocacy looks different for everybody, right? Some people want to be out there marching in the streets. Some people are like, oh, I'm going to write that MPP a letter. That's fine too. Find whatever your style is. But again, use the power of social media. I know you guys know how to use Instagram, TikTok, all that stuff. Get out there and spread the message of what's happening in healthcare, what's happening with mental health, and really push people for change. I think that's what we want to do. So that's my little piece of advice.
Amazing. Thank you all so much. So vote, obviously, and get involved in any little way that you can. And I love that as well, that like everybody has so much going on in their lives. And so if the thing that you can do is make a donation to an organization you believe in, that's cool. You want to do like a social media post about something or an issue that you feel passionate about, that works too. It's definitely like a customizable thing, advocacy, and however you want to get involved. So I really appreciate all your answers, and the fact that you all have the same answer is a good sign that, these are all very good pieces of advice. So I just wanted, just at the end of this discussion, just to create a little bit of space for anything that maybe I didn't ask, that you maybe wanted to touch on, or you felt needs a little bit further clarification or development, or just whatever you want to say, just near the end here. And also no pressure. If you don't want to say anything else, that's cool too. So I'll just open it up to anybody who wants to speak.
Maybe just adding on the fact that we talk about healthcare as universal healthcare. We talk about how we have such a robust healthcare system, and mental health does not fall under that universality, nor does like dental care. And these are other aspects where we see, marginalized communities and racialized folks suffering in these particular areas. And this is why I continue to say we do need to lobby our governments. We need to be very aware of what's happening at these political levels, like you had mentioned, Maggie, that healthcare here we're looking at the provincial level, and we have to get involved in these areas, because the only way we can change how our healthcare system works is if we understand it, for one. Because I think we have this fallacy where everything's covered. Mental health supports are rarely covered. I drop $200 a month to talk to my psychologist, and that is definitely an afforded privilege that I have. And that's not a privilege that most folks have. So how do we make sure that our system is looking and benefiting all folks and not just some folks? And yeah, we need to push for what we consider universal care. And the fact that we don't have universal dental coverage, the fact that we don't have mental health coverage is a huge problem. And we need to continue to talk about that and push for change.
Yeah, I think that's so important, because when you talk about Canada and Canada's healthcare system, like we get very used to, using our healthcare system as being this beacon to compare the United States and other failing healthcare systems against. But ours is not perfect, and it's also getting worse, obviously. And it's interesting as well, like what you've both brought up, just about how things are funded, who they are funded by, and who is in charge of certain areas in our political system. And I think a lot of people probably have the base minimum knowledge of civics from maybe high school that they remember, but then anything beyond that, like, are there any websites or like resources that like you could recommend? Because even myself, like there's always more that I feel like I could know, and I just don't even know really where to begin.
Yeah, one that I really like is called Progress Toronto. They do some like workshops on like like how do politics work. I actually have been wanting to do like through HPAP like a series on like a politics 101 because I think it's like it's so confusing. Like even as like I'm somebody who is, paid by the government and I am constantly speaking with city councilors and lobbying certain things and then I'm still like blown away on how things work. Like I recently learned about how prison healthcare is funded and it's completely separate from provincial healthcare. And it's just, they don't make it easy to understand, right? But Progress Toronto is a good one. And now maybe HPAP will do some kind of series in the future. And then there's lots of like, I think you can find the answers on your own. Like I've definitely gone and found like certain like PDFs or just looking things up and Googling what an MPP is. And I think that's all okay. Like it's better than just being embarrassed that you don't know, which I think is where a lot of us tend to default. But again, that's benefiting like people who are already within that system. So I tend to try and be very open about like, well, I don't know how that works. I need to look it up. And I think that's totally okay.
I would 100% echo that. I continue to be like mystified by the way some of these things work, and I'm always learning new things that really just don't make a lot of sense. And I think again, it's like that's what benefits them is that we don't figure out what's going on. So yeah, don't be like embarrassed and just like ask. And I think one thing that I've also been surprised by, like pleasantly surprised by, is just I mean, politicians they often like they want to be reelected, so they want to listen to their constituents, and so they're often like more than willing to meet if you reach out. Like I initially thought, oh, it's gonna be so hard to try and see my MP or MPP, but they were happy to like they're like, oh, there's a Tim Hortons near my office, let's go meet up there for coffee. I was like, okay. And then again, as Amy kind of mentioned, you take photos with them and post it on social media and you say like, okay, it was great speaking to you about this, I love how you committed to advocate for mental health, and you hold them accountable to that. And then it's makes it again that much more kind of like transparent for everyone.
Yeah, and then I think just to add, like listening to podcasts. So I don't want to put in my very biased podcast that I listen to, but like I'll just say, Left Turn Canada or the Rational National. There's like lots of great political podcasts that you can listen to, and that'll help provide insights as well in terms of just better understanding the system.
Thank you so much for listening to this Life on the Line podcast series episode on socioeconomic inequality and youth mental health. And a big thank you, of course, to Amy, Nikhita, and Maggie for their time and expertise in this discussion. And if you'd like to learn more about any of them, their links, their initiatives will all be down in the description below. And if you'd like to learn more about the Canadian Mental Health Association Toronto and the ART fundraiser and campaign for their youth mental health programs, that'll all be in the description down below as well.